This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon. I'm Jill McCormick. We once again interrupt our programming to bring you a special report and update on the spread of COVID-19 in Erie County specifically. Let's go to the studios of WQLN, where Erie County Executive Kathy Dahlkemper is standing by for her daily update.
Good afternoon, and thank you for joining me as we speak about the COVID-19 pandemic here in Erie County. Today we have 2 new confirmed positive cases in Erie County, which brings us to a total of 29 positive cases of COVID-19. We have 739 who have tested negative. The 2 individuals that we're speaking of today are both in their 30s. And to follow up from yesterday when we talked about 4 positives that had come in that late in that day, those 4 people from yesterday are all in their 50s. Investigations continue by the Erie County Department of Health on all of those open cases. The state numbers, again, are staggering today. The state positive cases are 14,559. with 240 deaths across the Commonwealth. This is 1,579 more cases and 79 more deaths in the past 24 hours. Included are these numbers are Warren County still with 1 case, Crawford County at 9 cases, and Allegheny County, Pittsburgh area, at 689 cases and 6 deaths. More information from Crawford County can be found on its website, crawfordcountypa.net. And they have also established a Crawford County, PA COVID-19 informational Facebook page, and the commissioners in Crawford County has set up a COVID-19 informational line, and that is 814-373-2504. Again, the number in Crawford County is 814-373-2504. Erie County, I mentioned yesterday, New York, which is the Buffalo area, now reporting over 1,163 cases and 30 total deaths. And Chautauqua County has 19 cases and 2 deaths, with Ashtabula, Ohio having 15 cases. So as we continue to look at these numbers and continue to work together to stay ahead of the spread of COVID-19 in Erie County, I'll say it again. Please stay at home unless you absolutely must go out. When you do go outside, wear your mask and stay at least 6 feet away from anyone at your home. I went for a walk myself last evening. I took my mask with me. When I didn't see anyone near me at all, I sometimes would take my mask off. But when I would see anyone approaching me, or I was passing by anyone, then I would put my mask back on to protect them. Because remember, my mask protects you, your mask protects me. Please care enough about the people you're coming in contact with to wear a mask when you are out. As we take advantage of the warmer weather, I want to talk just a little bit more about fishing. As we discussed yesterday, trout season is upon us, and in fact, today, season opened for trout fishermen and women in our community. This early opening of the trout season will allow our licensed anglers and youth to begin fishing for trout immediately. The hope is to spread out the season and allow everyone to stay in those socially distanced methods that we've been talking about. So anglers and boaters, you must abide by that social distancing guideline. Stay close to home when you go out fishing. Wear a mask and keep at least 6 feet distance from one another. More guidelines and a great video done by the Pennsylvania Fish and Boat Commission is available at eriecountypa.gov. On another note, the IRS has reported a surge in scam artists perpetrating what we call phishing schemes, but this has nothing to do with a fish in the water. This is phishing schemes that are targeting people who are expecting a stimulus payment from the federal government following the outbreak of COVID-19. The U.S. Treasury Department and the IRS announced the stimulus payments will be distributed automatically, and no action is required for most people. Our environmental task force has received 105 complaints yesterday and continues to make field inspections and offer assistance. So if you need information or guidance, please again go to eriecountypa.gov. Many resources there. Call us at 451-6700 or email ecdhinfo@eriecountypa.gov. And I want to remind everyone that we also have many of these items in different languages for those who might need them in our community. Finally, just a final reminder that this is National Public Health Week, and I thank all of those in public health working diligently every single day for all of our safety. And they've had many people show their appreciation to them, and if you would still like to do that, you can send them an email at ecdhinfo@eriecountypa.gov, or you can send them a nice note or a drawing to 606 West 2nd Street, Erie, 16507. And with that, I'd now like to open it up to our media for questions. And today we'll start with Jet TV.
Hi, Kathy. Samir. Do we know if any of these cases are related? Both are in their 30s from today, and then yesterday you said all four in their 50s.
I know that all of our positive cases reside in different locations.
So you don't know if they were like all traveling together?
I don't know that, no. But I know that they all,
okay.
their place of residence is all different. Erie News Now?
Hi, a question for you about trout season here. How do you plan to go about trying to enforce these social distancing guidelines? There's just so many different places to fish and everything in the county. Will you be sending teams out trying to keep an eye on kind of fishing hotspots? Just curious about your approach to trying to keep people safe while letting them, enjoy the outdoors.
So the Fish and Boat Commission, I'm sure, will be doing their part to try to make sure social distancing is happening. They have a great graphic which shows somebody holding their fishing pole out and holding their arms straight out with a fishing pole, creating that 6-foot distance between you and the next angler that would be out there. And they've also put up very good signage at all of the places where people tend to congregate to fish. And so they are trying to remind people through various means. And obviously, it will be addressed by us locally if it needs to, but the Fish and Boat Commission usually does an excellent job of patrolling their areas. So we'll lean on them a lot to help us with this. Talk Erie?
Yes, good afternoon. Hi. I wanted to follow up on something that we talked about on Saturday regarding the quarantine orders that you have people sign if they have a member of their household that tested positive for COVID-19. Do you have any idea how many quarantine orders that you have out there? This came up today earlier with Secretary Levine. Can you give us a number?
I cannot give you a number, but we have 29 positives. So just think about some of those people had close contact with numerous people. Others had close contact with maybe just a few people, but that would exponentially grow no matter what. So I don't know how many people that have signed those letters and are in quarantine, but I also know that our first positive cases, those people that were connected to them that were quarantined are now coming off of their 14-day quarantine. So that then will continue to happen as people reach that 14 days if they've been symptom-free.
Okay, thank you.
Erie Times News?
Yes, Kathy, it's David. Are you aware of any of the 29 cases being currently in the hospital? And do you know if any of them are nursing home residents? Have there been any cases reported in any of the nursing homes in the county?
The ones that we have a record for are not in the hospital. None of them are in the hospital as far as I'm aware of. And I'm not aware of any nursing home issues, I guess.
No cases at any nursing homes, whether we're talking about staff or residents?
Not that I'm aware of. Not that I'm aware of. I know there's been some talk. I'll just talk about Pleasant Ridge Manor because that is a county facility, and I had a conversation out there with the CEO at Pleasant Ridge Manor, and he assures me that there have been no cases there, and because I know there's been some rumors about that. But I also want to make you aware that they are doing out there, what I think many are doing, and that's preparing if they do get cases, readying rooms. I've been informed that they will have a separate staff that will be there working if they have cases so that they can keep everyone in one part of the building and therefore greatly, hopefully, reduce the spread to anyone else if they get a case of COVID-19. Jet TV?
Yeah, so I want to transition a little bit. So yesterday you announced that there's signs of community spread in Erie County. So I was just wondering if there were to be like a common location that we were to see this community spread happening at, would you announce that location?
I believe that if we had an area where we felt there was just a big hot spot, I guess would be the best way to put it, then we would definitely inform the community of that. But there is no hot spot in Erie County. The people that we have seen out of those 29 really are scattered all around Erie County, and so there is no area where we would be concerned of this potential hot spot. But we would definitely look at that if that happened, and I believe that we would move forward with letting the community know if there was a hot spot to be dealt with.
Perfect, thanks.
Erie News Now?
Hi, a question for you we've got from a handful of viewers wondering about, is there anywhere they can go? Is the county looking to help people if, say, they have to quarantine or self-isolate, anything like that, but they're not in a situation where they have an extra bedroom in their home, where they have a bathroom that can be used just for them? Is there any way for them to get away from the people they love and reduce the risk of infecting them, or do they kind of have to stay home and just try to make the best of it?
No, we do have contingencies for anyone who becomes positive that does not have the ability to isolate. So there's a difference between isolate and quarantine, and isolate would be for the person who is positive. We definitely want them isolated away from anyone else in their home and, of course, the community as a whole. So if they're not able to do that because of their living situation, too many people in the house, not enough bathrooms, not enough bedrooms, those type of situations, then we would be able to accommodate them. And so that is something we've been working on since the beginning, and we have those facilities ready to go if needed. But we haven't had that need yet. Talk Erie?
Yes, could you share the status of those two hotlines that you set up, the community helpline and also the rumor line?
So we've had lots and lots of calls, I give you the numbers many times on our what we call our enforcement team. Those are the kind of calls that are coming through the 451-6700, but there's many other calls coming through there of people who need guidance. Maybe they're feeling ill, they're not sure what to do, send them on to their health care provider. And people have just a multitude of questions. The same with the rumor hotline, although we've found that some people are calling that number when they really should be calling the 451-6700. The 451-6700 number is monitored 24/7. It does have a call service, and if there's any type of call that comes in on the weekends and during the night that need to be addressed, then the staff at the Erie County Department of Health come in and address that. Versus the rumor hotline is only a Monday through Friday, mostly a work hour call line, and those all go to an answer, to just like basically an answering machine. You leave a message, and then we have an individual who checks those a few times a day, and then routes calls where they need to be. So the rumor hotline was really more about trying to find out things that aren't urgent at this moment. And so we've had numerous calls on there, but we're evaluating whether the rumor hotline is necessary or not, and I'll probably have an answer with my team by the end of the week, because we find some of the calls are just overlapping, and many of the calls are actually going to the 451-6700 number anyway. They're transferred to that staff of people that are staffing that other phone line. But I don't have a number of the calls because there's been many, many, many calls.
Gotcha. Real quick follow-up. You had mentioned back on the 26th about the community chat line. Is that that 273-7007? Is that something that's being handled by another agency other than the county?
Erie County Care Management and the team of social workers and are manning that number in conjunction with my Department of Human Services. So that line has been also, used by our community, and now we know that there's also a call line that's 24/7 that you can access off the state's Department of Health. And so those are very, very important, and that's for people that are feeling anxious, maybe a bit depressed, isolated, any emotion that you're struggling to deal with right now, and we're all struggling to deal with a lot of emotions right now. So if you feel like you really need to speak to someone that might help you get through this, then please call those numbers, and those numbers can be found on eriecountypa.gov. But but the number for our county chat line is 814-273-7007, and there are people there to speak with. And so I encourage people to call if you're feeling overwhelmed and you just don't know how to deal with your emotions. That's a great line to call. Thanks for bringing that back up. Erie Times News.
Yes, Kathy, could you break down the 29 positive cases by race, by sex, and by age?
I actually don't have those figures with me. I've told you the ages of them as they've come through. We have not revealed the sex nor the race of any of these individuals. You did ask a question, David, yesterday about gender, and if we see this greater numbers in males than females. And as I said yesterday, 29 people really isn't large enough to do a true look at those and see if you see a trend. So we did look at the state numbers, and actually what we saw was 50% of the state cases are female. So I think it's sort of a myth maybe out there that this hits men more than women, but we're certainly not seeing that here in the Commonwealth. In fact, it's fairly even, men to women. And in terms of race, the only thing I can tell you about the race of the 29 people in Erie County is, compared to other communities that we've been looking at across the country, and when hearing these horrible stories of the race disparity that's been observed, we do not see any of that here in Erie County, and we'll certainly be watching for that, because that's completely unacceptable, that people would suffer greater just simply because of their race.
So what you're saying is you're not seeing the disparity, but you're not going to provide the specific numbers on the 29 cases.
I don't even have those. I don't even have the race of those 29, but I did talk to my team about this issue, this greater issue that we're seeing across the country, and they're not seeing any racial disparities. And you have to remember, we don't even have anyone hospitalized, and we've had no deaths. And I think what they're seeing in some of these other places is when people become hospitalized, and then of course the death toll being much, much greater for people of minority status. We don't, thank God, have had no deaths here in Erie County, and no hospitalizations. So at this point, currently, in our hospitalizations have mostly been those who've come from outside of our community. So I feel very good about where we're at right now. Let's keep it there. What we're trying to do constantly is save lives in this community, and that's for everyone. Doesn't matter your race, your gender, your age. We're trying to save everyone's life. Erie News Now. I'm sorry, Jet TV was next. I'm sorry, Jet.
Yeah, hi. So I want to talk a little bit about food. Obviously, we know that is life-sustaining, and some people, farmers, might be growing or planting. So I know I've spoke to a couple people who are saying they can't get proper planting equipment or garden or plants to grow a garden, etc. due to the centers being closed or departments being closed, not receiving a waiver. So is that something you've thought about appealing yourself to the governor?
So garden centers and places that have plants actually can sell their goods, but it needs to be by order, and then the people need to come up in their car, and then the order would be placed on their car. The reason is, you know, I mean, I love going to a garden center probably as much as anyone does, and just browsing around and looking at the vegetables and looking at the flowers and all of those kind of things. And it's a really wonderful experience, particularly in the spring as we come out of winter. But we also know that also our garden centers, because they're such great places to be, attract a lot of people, and it's very difficult to social distance yourself often in those centers. So this is the balance, is that you can still get those items, but you're going to need to trust the garden center that you are buying your stuff from, that they will pick you out exactly what you want and a nice product, and then they will put it right in your car, and you will drive away and be able to go home and plant your vegetables. So you're still going to be able to get them. It's just going to be a little different this year than it has been in past. But that's pretty much the way it is with everything right now. It's just different.
Thank you for clarifying that. And then I want to switch gears a little bit and talk a little bit about the Erie County Prison. So how prepared is the prison? I know I believe there's been 3 tests on inmates there, and they came back negative. So just in case if we were to see a COVID-19 positive case within the Erie County Prison, would that count as a county positive? And is there enough PPE equipment there for the guards?
So, of course, if that person would count as a county case, because they would be a county resident and someone who is here with us. And, I mean, it's important to remember that the county jail is different than, say, for example, SEI Albion, which would have prisoners from all over the state. But our jail, for the most part, unless someone's come here and committed a crime, our jail is filled with Erie County residents. One of the great things that's happened is working with the court system. The warden and the public defender and the courts have been able to get many people out of jail. So our numbers there are way down. We're in the low 500s versus often being at 650 or more inmates. So that's good. The more people we can get out of jail, the better, because, you know, when you've got people living in a congregate setting, and whether that's a jail or a nursing home or some kind of residential facility, you know, it's just a greater risk. You just have, it's very hard to social distance when you have people living close quarters. When you go into our jail on any day, anyone who goes in there, but you wouldn't be able to go in unless you had a need to, everyone is given a temperature check when they go in, and that would include any new prisoner that might be coming. So we are constantly looking for signs, both with our employees as well as anyone else who might go in there. And then lastly, working very diligently with our court system. We have 3 rooms set up for a prisoner to have their initial hearing with the magistrate justice or with the judge, and that's really good too. So work is not stopping, and people deserve to have the right to be quickly seen and moved on in their court action. And so I commend everybody from the courts to the jail staff to the IT department who really worked diligently to find a solution where we can still socially distance people, but give them their rights and the due process that we are all given under the Constitution. Erie News Now.
Hi, I'd like to touch more on the idea of helping people get out of homes if they need to isolate. Can you tell me how many people the county could accommodate, and then take me through the process of how those people would be treated, how you try to take care of them while they're outside of their homes and in these designated locations?
So we don't have anyone in that position now, but there was, right in the beginning, we looked at how we would do that, and so we would find them a place to be, a room comfortable where they could have a full bathroom facilities. Meals would be provided for them. No one would go into their room to clean it or to give them their meal. Everything would be brought to their door. Any needs that they have, whether it be medicine or, certainly food, all of that would be delivered to them and then left at their door, and then they would take it from there. There would be constant checks with them from the health department staff, and they might even need to talk to somebody, some kind of a counselor or social worker, if they're struggling being alone, which we know would be very hard for many, many people. So that's the kind of care that we would provide to try to make it as comfortable as we can, knowing that they're not in their own home. And I'm not sure about,
do you have any?
I don't know how many we have up and ready, and but I know that the contingency is we could, what we're planning now and what the staff is doing in many ways is planning for worst case scenarios in all sorts of area, and this would be one of those places. And as we would see numbers increase, if we needed to do that, then we have plans for how we could expand that out, if that makes sense.
Thanks.
Talk Erie?
Yes, ma'am. I want to go back to unemployment. With the public library being closed, that would be the typical place where a lot of initial claims would be made on those public computers for those that don't have internet access or a computer at home. Do you have any guidance for the many Erie County residents that are unemployed and don't have internet access? The phone call, the 888 number for initial claims, is nearly useless to the state.
This is a really, really difficult part of what people are struggling with, to not have the technology that we need. I talk about going on our website, and yet we know that there's many people who are not connected to the internet. Either they don't have the ability to connect because there's no fiber to their home, or they don't have the funds to be able to connect and pay the cost of internet, or they don't even have the equipment that even would allow them to pay for the internet. So there's many scenarios. So we're working to try to do what we can. I know many of the schools have passed out pads or laptops or whatever to their students, so hopefully that brings maybe a device into a home that's not there. Hotspots are being brought up as fast as we can. We're looking to make all of our library branches a hotspot so people could pull up into the parking lot and access the internet. They would have to have a device of some sort, of course, to be able to do that. But the issue is we have to get antennas that will allow us to do that, and because everyone else is looking to do the same, those supplies, those pieces of equipment are very difficult for us to obtain. So we're working on it, and we're trying to find a source for some of these things that will help our community as a whole. My understanding is we're working with one of the large cellular providers to obtain hotspots that would be given out to teachers and administrators in the school districts, because we probably have some teachers who even live in homes where they don't have fiber to the house. So they may be struggling to even do the instruction that they need to do from their home because they don't have connectivity in their own home. So there's just a myriad of issues. This is just one more of the many, many issues that my team is trying to assist with. Yesterday I was on a phone call with the superintendents of the Erie County school districts to see how we could assist them with some of the struggles that they're having. And so we really have a great team, but we're all constrained by the resources that we can find and the resources that we can bring in today, and that's been a challenge for us. Erie Times News?
Yes, Kathy. State Police put out a couple news releases today about warnings that they have issued throughout Troop E, which I know is not just Erie County, but it includes Erie County. They had 8 business warnings just yesterday, and then 3 warnings last week for groups or individuals. The number of those, is that a concern to you? Is that jive with what you're seeing as far as there are still businesses and groups that are not complying with the stay-at-home order?
Well, it concerns me because people are not complying with the stay-at-home order and the social distancing mandates. But I don't know where the Troop E's cases were, but I imagine many of them are actually not even in Erie County because we have such a strong enforcement team through the health department, because we have a health department, and they are taking many of the complaints and many of the concerns in our community, and we're dealing with them internally with county law enforcement, whether that be the sheriffs, the detectives, the probation officers, as well as enforcement individuals from the health department. So that's happening. I think we probably have one of the best enforcement operations of any community near us. because of the staff that we have, and we jumped right on that, and we created this really great team who fields complaints. As you could see, sometimes, overnight, I forget, we had a lot, like 70-some complaints come in. Some of them aren't necessarily that we have to go out and follow up. Some of them are just a phone call, and then we can find out maybe this business is allowed to be open, and then again, we just help them be compliant.
And is it still reached the point where no one's been cited for this?
No one has gotten to the point where they have been taken to a place where they are going to get any fines or any court action. So we've only really had 1 or 2 businesses who kind of fought a little bit on this, but eventually they, within a day or two, they did the right thing. So the businesses are being compliant, and so we continue to work on that. But, again, if we have a business that's not, there is always that opportunity. I mean, I don't want to say we want to do it because we don't. We don't want to really hurt businesses. They're already hurt enough. We're trying to just get everyone to do the right thing so that we can stop the spread of COVID-19 and eventually get ourselves back to normal and back to opening up all of our businesses. But we'll never do that if we don't all work together, and we need our businesses to cooperate, and the vast majority truly are. Jet TV, do you have any last questions for me?
Yeah, really fast. I want to backtrack to the prison stuff. So are guards there allowed to wear PPE if they want to while they're on duty?
So we are providing personal protection equipment to our guards, to anyone who's having close contact with people and is in that kind of frontline duty. So yes.
Got it. And then my last question, I don't know if you could even answer this one, but I've noticed a lot of comments just wondering how long or how quote-unquote new are these COVID-19 cases. Do we have a ballpark estimate for how long it's taking to get these testing results back?
Well, very interesting that you would ask that, because we had a discussion about this today, and this is really frustrating for us, and I'm sure even more frustrating for the person who's been tested. Some tests are coming back in less than 24 hours. Other tests are out there for days, and we don't see any rhyme or reason. It's not one system versus another, one lab versus another, and I'm hearing this not only here but really across the Commonwealth, and I'm not sure about across the nation, but it is one of the things that's really holding us back from even doing better work than we're already doing. If we could get those tests back even quicker, then that person would know for sure, obviously release their anxiety one way or the other. If they're positive, get them, we already have told them they should isolate themselves, but get everyone else quarantined that's been connected with them. And so that is something that would be great if we could get these tests back within 24 hours. But we're not seeing it, and we have no control over it. We don't do the testing at the Erie County Department of Health. It's all done by our health care providers and the labs that serve them. Erie News Now, do you have any last questions for me?
One final one. Any luck tracing either the cases from yesterday or the cases from today? I know you said you're still working through it, but have you ruled out community spread on any of those cases?
I don't really have any further information than I gave you. We know we have some community spread. It's certainly not widespread like you see in some other communities I've spoken to, but we know that we have a few people we just can't figure out exactly pinpoint, was it a positive, was it travel related, and those are the ones, of course, that concern us. How did they contract this? And that's what even makes me more decide to wear my mask, which I've been wearing, as I showed you. I wore it in here today, and I'll continue to wear it. Wash it at night, keep it clean, and I have a bandana in my car just in case I forget my mask, so that I can wear that when I'm out and about. And that's what we need people to do. We need people to stay home, wash their hands, wear a mask when you're out. Everybody needs to do what they need to do to protect themselves and then to protect those people they come in contact with, because we do know somehow people are picking up COVID-19 and they don't really know how they did. Talk Erie, do you have any last questions for me?
No, ma'am. Thank you.
And Erie Times News, do you have any last questions for me?
Yes, Kathy, one last one. So 29 cases, none of the Erie County ones have been hospitalized. I don't know if maybe Dr. Nadworny has said something, but any of the medical folks that you're in contact with, have they said how unusual that is or reasons why? It's great, it's great news, but why none of them have required hospitalization?
Well, it's interesting because many of our people have skewed to the younger age. We've had, we have a teenager, we had a number of people in their 20s, a number of people in their 30s, even the 4 people in their 50s. They're younger than me, so I think that's pretty young. We've only had a couple people in their 80s, and that's of course the age that we really start to get concerned. And we had one in their 70s. I think was yesterday's numbers too. So. It's interesting, and I don't really know why, but I guess it's just the people who maybe traveled and brought COVID, back into our community, and then other people had connections with them or had with somebody else who had COVID somewhere. And so I think the younger population of our positives is probably one of the main reasons. But let's hope we can continue to protect our seniors. I can tell you I've gotten some really great notes from people. Just yesterday, I think, or over the weekend, I got a nice note from a couple who came back from Florida, and I think tomorrow may be their 14th day back, but they did what we had said. They quarantined themselves. They drove straight through, they said, so they wouldn't stop and stay anywhere overnight. They came home to Erie. They quarantined themselves in their homes, not seeing their family. They showed great pictures of the grandkids outside the window on the grandmother's birthday the other day, and that's what we need everyone to do. So the more people can do that, I think they will protect themselves. Obviously, most people who go to Florida for the winter are at least retirement age, and they know that they are in that higher risk age. And I think that could be another reason is our seniors are really doing what they're supposed to be doing. Even when I go to the grocery store and I see who has masks on and who doesn't, it tends to be older people who have the masks on. And so I think they understand the importance of this, the sacrifice of staying home, and how important it is, where I think sometimes our younger people think, well, if I get it, it's not going to be that bad, and really I can't stay away from my friends, so I got to be with them, and so they go out and find ways to gather, and then we have, of course, more of an issue with the spread. So we should listen to our elders' advice, I guess, and follow their actions, because they are, for the most part that I've seen, they're doing the right thing and they're doing it well. Any follow-up with that, David?
No, thanks.
Okay. Well, otherwise, thank you again for joining me today. Please help us to continue to keep Erie County in a very good place. We are the 31st in the Commonwealth of counties in terms of the number of cases. We are the 15th largest county in the Commonwealth. So we are doing much, much better than so many of our neighbors within Pennsylvania, and we want to stay in this position of stopping the spread, of reducing, flattening that curve, of allowing our health professionals to be able to deal with any cases they have to deal with, and to do it safely. So the more we can all do together to save the lives and to save the lives of our healthcare workers in this community, the better off we're going to be. So thank you all for doing your part, for staying home, for washing your hands frequently, for not touching your face, for wearing your mask when you're out, for the safety of everyone else. And thank you for staying home, for staying safe, and for staying calm.
And you have been watching today's update on COVID-19 from County Executive Kathy Dahlkemper. In case you just joined us, here are some of the highlights of that update. Again, Kathy Dahlkemper saying that we had 2 new positive cases. It appears that those are, again, from a small community spread. She says that it's not as bad as she has seen in other counties when it comes to terms of community spread. 29 positive cases now total. She said some frustration within the county here and really across the country when it comes to testing. Some of those positive cases coming back within 24 hours, others taking days for those results. And she said that's not a problem just seen here in Erie County. It's something that many municipalities and counties are experiencing. She said too, in terms of everything when it comes to trout season, of course, the soft start started today. Reminder to those anglers to maintain their 6 feet, their social distancing. The Fish and Boat Commission, they will be out making sure that people comply with that order. She said just be careful if you do that. Another thing that I found interesting, is that she said all of the positive cases so far live in different locations. We're not seeing, again, that contact spread within homes. These are people who so far all live in different spots and different locations throughout the county. Also, she said if we did have a hot spot, if there was some common denominator with these positive cases, that she would probably make that public. But so far, there has not been a hot spot in Erie County. So let's take a look now at those numbers in Erie County. 2 new positive cases reported today, bringing our total to 29 positive cases. 739 so far testing negative in Erie County. And that number at the end too, she said out of the counties, I believe she said Erie's number 31 in terms of counties in Pennsylvania when it comes to the number of cases. In Pennsylvania today, we heard 14,559 positive cases, 240 deaths so far, 76,719 though negative cases. Of the number of positive cases, we have 1,665 hospitalized so far. In other counties, we had in Warren County 1 case reported. Still, that's where it maintains. In Crawford County, 9 cases there. Ashtabula County in Ohio, 15 cases. They also gave out a phone number too for Crawford County. They do have a new informational line that you can call if you live in Crawford County. That number 814-373-2504. She also mentioned a Facebook page. You have to remember too, Erie County, we have our own health organization, so it does make things a little bit easier for us in terms of who to go to. So Crawford County setting up that informational line again, 814-373-2504. Let's also talk about in terms of Erie County. Again, we had the 29 cases, 29 reported in Erie County, 2 additional reports. And across Pennsylvania, as we said, more than 14,000 cases. And again, the best advice to keep these numbers low, they say you should stay safe, stay calm, stay home, wash your hands often, practice social distancing. But really during this time, we're hearing from not only County Executive Kathy Dahlkemper, but Dr. Rachel Levine, stay home. The next 2 weeks are going to be crucial for that. If you don't need to go out, do not go out. And if you do find the need to take care of something essential like a grocery store or pharmacy or gas station, wear a mask and practice proper hygiene. That mask protects other people from getting it in case you are a carrier. So everyone needs to wear them in order for that to work. Don't feel like it's a safeguard against coronavirus COVID-19. And we do want to remind you too, Jet 24 carries a live digital exclusive coronavirus newscasts daily. That's at 11:30 a.m., 3 p.m. and 9 p.m. on our website, YourErie.com. Of course, we will have a complete wrap-up tonight on Jet 24 beginning at 5. And we are live every night at 7 p.m. on Facebook to wrap up the day's events and to keep you informed about the latest on COVID-19 in Erie County, in Pennsylvania, and across the nation. Thank you so much for joining us. I'm Jill McCormick. Have a good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to YourErie.com. We now return you to your regularly scheduled program.